My child will be doing just fine. He doesn't need those weird chemicals to be inserted into his body. I will never let my children get vaccinated. Have you heard that vaccines can cause autism? My great-great-grandfather has been alive way before vaccines, but he's never gotten sick. The big pharma is intentionally putting harmful ingredients into their vaccines so they can put our children in danger. You're probably familiar with those sentiments that are commonly heard from people who oppose the vaccination of children. However, are any of these statements actually true? Ladies and gentlemen, my name is Khalisha. I'm from Shafana Islamic School Upper Secondary, and on this occasion, I would like to talk about the misconceptions regarding childhood immunization and the problems that arise from the transmission of these fallacies. Often, people are easily convinced by information found from unreliable sources without doing any fact-checking. This is what leads anti-vax people to have those beliefs. Some may say that vaccines can cause autism. Well, the truth is, the paper in which this information was released was eventually debunked by newer studies, which show that there is no real evidence suggesting that there's a link between autism and vaccines. Some people may believe that vaccines contain mercury, making it dangerous. While it is true that vaccines contain mercury, however, it's not as harmful as you may think it is. The chemical in question is thiomerzol, which is a mercury-based chemical compound found in the vials of vaccines. This substance acts as an anti-pathogenic preservative. According to the CDC, in fact, this chemical doesn't stay in the body long enough to cause any adverse reaction, thus making it safe. Some people may think that people in the past could live without vaccines. If anything, in 1955, prior to the licensing of the polio vaccine, for instance, an average of more than 16,000 paralytic polio cases and 1,879 deaths from the disease were reported annually until the introduction of the vaccines in 1962, which contributed to the drop of the cases to less than 1,000, and the rate stays at less than 100 in the following years. A lot of sources, especially the internet, can be an easy pathway for you to be trapped into the realm of misinformation. Therefore, it's important for everyone to always do further research so they can educate themselves. The impact of spreading false information concerning vaccines should never be taken lightly, and here's why. In 1998, after the disreputable paper about the link between measles, mumps, rubella vaccine and autism was published, this paper received so much attention that it generated the drop of the MMR vaccine coverage rate and also the comeback of the disease in the United Kingdom. Furthermore, earlier in this decade, the COVID-19 pandemic has put our world into disadvantage. This includes the rise of health misinformation, especially about vaccines. As a result, there was a plummeting of the DPT-3 vaccine coverage rate among children who are living in countries in a risky state. According to UNICEF, the rate of essential vaccine coverage for children in Indonesia has fallen from 84.2% in 2020 to 79.6% in 2021. Consequently, the children in our country are put to a state where they are even more vulnerable to get infected by diseases that are supposedly preventable by vaccines. This includes diphtheria, tetanus, rubella, and measles. This proves just how incredibly crucial childhood immunization is. In every minute, a squeeze on the syringe can save and protect 5 lives worldwide, reducing susceptibility to diseases. Multiple diseases have been successfully eradicated with immunization. If we make an effort to make knowledge on the significance of vaccines more accessible for everyone, we can fight health misinformation and also encourage everyone, especially children, to get vaccinated. Obviously, we don't want to be living in a world full of worries about diseases and the constant fear of catching them. With that being said, for the sake of the lives of our future generations, together we can fight medical misinformation and also get our children to be vaccinated. Before I end my speech, I would like to give a huge amount of appreciation and gratitude for your attention. This is Khalisha signing off. Goodbye and thank you.